Protecting our future means protecting and nurturing our children and making sure they have the best chance to thrive.
That's right. When a child has complicated medical needs, negotiating care can quickly become overwhelming for their family, but a Houston facility is stepping in to help. KPRC2's Robert Arnold is here to introduce us as they work to build a stronger Houston. Robert.
According to UT Health, less than 1% of children in the U.S. are considered medically complex, but these children account for 40% of pediatric deaths and 54% of all pediatric hospital charges. We had the opportunity to visit a clinic that is helping change those numbers.
Hi, good morning. How are you doing today?
The work is delicate.
Very good, Nathan.
The work is critical. This is the UT Physicians High-Risk Children's Clinic.
We see children with medical complexity. Those are children with chronic illnesses, children who require some type of technology to survive.
Dr. Ricardo Mosquera is a pediatric pulmonologist and director of UT Health's High-Risk Children's Program.
We're trying to avoid unnecessary ER visits and also unnecessary ICU and hospital admissions.
This clinic is paramount. It would be impossible for the level of care he needs for us to get it at a regular pediatrician's office.
Cheryl Lingenfelter's son Nathan is one of 600 patients at the clinic. A tracheostomy tube helps him breathe, and he has a feeding tube.
Very good, Nathan.
At 6 weeks old, Nathan succumbed to SIDS. He was revived after 20 minutes. The lack of oxygen caused devastating damage to his brain.
Nathan has epilepsy, so he needs constant seizure medication.
A multitude of pediatric specialists are brought together under one roof. This way, parents don't have to hop from office to office or hospital to hospital for specialized care.
We can help them to navigate the system. We can help them to coordinate their cares with multiple specialists, with a social worker, with nutritionists.
The clinic also has a much smaller doctor-to-patient ratio than the average pediatrician's office.
A typical pediatrician in town, they see around 20 to 25 patients per day. Here in this clinic, a pediatrician here sees 4 or 5 patients per day only.
Dr. Mosquera says one of the keys to this type of care is having a robust telemedicine program and having doctors who are intimately knowledgeable about their patients' needs being available 24 hours a day, 7 days a week.
With the telemedicine, we can be more proactive with the patients. We were able to initiate the treatment earlier.
Technology also helps doctors check a variety of vital signs from afar. For parents like Lingenfelter, that's a blessing. She lives close to 2 hours outside of Houston, and transporting Nathan is a difficult task.
It's a lot just because I have to make sure I have everything we might need, everything we will need, and everything we could possibly need. So it's a big undertaking.
How critical is a clinic like this to Nathan's life?
Oh, extremely. Like I can safely say that this clinic has probably saved his life multiple times.
Dr. Mosquera and other physicians at UT Health have published studies showing this type of care can drastically reduce the amount of time a medically complex child spends in the hospital, which also cuts down on the amount of money needed for treatment. We'll have links for those studies on click2houston.com. Robert Arnold, KPRC2 News.